I have been gone for a long time, and I'm so sorry to you guys. Like, I've lost subscribers, but I will say shout out to the FAMU students for continuing to contact me with hopes of getting into nursing school, asking me tips about FAMU nursing school, asking me about FAMU, and I really appreciate you guys. I will put an alert out there though. I have been out of school for almost a year and a half, and I will say that FAMU's admission process, their curriculum has completely changed from when I was there, so I can no longer give current advice, but if you need someone to give you some pep talk, pray, give you some encouraging words, I am definitely there. And this is not just out to the FAMU students, this is to nurses, current nurses, this is to student nurses, this is to prospective student nurses. I am here for you guys. I am glad to be back. I had to really get my bearings together as far as getting life together and figuring out being a new nurse, new bills, being an adult, and being in a new relationship, and all of those things were just so overwhelming. But I will say that just family, faith, God has got me through those things, that I am back with you guys to give more encouragement. Thank you to the ones that have been following me on Instagram and Snapchat. I have been trying to post very, very encouraging things each and every day, because it is important to stay positive, and keep you mentally healthy and happy. So I do encourage some mental breaks. That's always important. So I just want to get started because I left you guys off with the fact that I passed my NCLEX, I got a job. I even posted something on Instagram kind of updating what I do now, like a life update. But officially, I want to give you guys an official life update. So currently I am at Tallahassee Memorial Hospital in Tallahassee, Florida, and I work on the unit of orthopedics / med surg / trauma. So we got a lot going on, especially after this big hurricane Michael that came through. But typically what I do on a daily basis is the max is 6 patients at night. I work night shift, and currently it is like 2 a.m. So I'm a night owl officially, and we'll get into that as far as night shift and how to do your routine and switching back to days when you're off. But anyway, so with orthopedics, we do get our elective surgeries, which are people who are healthy or been screened to be healthy, and they have a planned surgery to get a knee replacement, hip replacement, things of that matter. And it's pretty cool. A lot of the people that come in, they're older, or either they're young and they have osteoarthritis, osteoporosis, and it's awesome to see them come in and they said they've had years of pain and all that stuff, and then day of surgery, getting up, walking, and minimal pain and feeling so much better. Of course, they cut into you, so you're always going to have some type of pain, but it's doable. And though some of those people come back up to our floor after months of recovery, and they come and thank us, and we're like, wow, you're walking so good, and it's just a complete turnaround. Another thing that we deal with is trauma. So because the hospital I work at is over 17 counties in the area, we do get a lot of like motor vehicle accidents, four-wheeler accidents, motorcycle accidents, semi-truck accidents, all of those things. So I have seen people split from chest to private area, and doing daily dressing changes and being encouraging and bringing in my godly spirit. And I fell in love with traumas. I love the critical care, or somewhat critical care. I love talking to those patients and kind of being a listening ear sometimes, because sometimes that's all people want, especially when we get a lot of young patients my age, around 20 to 25, and they've never been in something so tragic and feeling like they're never going to walk again, or feeling like they're never going to get back to their way of life. I met young men and women who have lost their leg and wondering, if I'm not going to have the same friends, is my boyfriend or girlfriend still going to love me? And those things are very hard, you know. And I've cried with patients, I've hugged patients, I've prayed with patients. So that part is very rewarding to me. And at first, starting orthopedics, I thought, it's orthopedics, it's bones, it's going to be boring. All my friends are going to the step down progressive units and ICU and cardiac, and I felt like I'm not going to get anything out of this, and I want to get out as soon as I can. But I love it. I love it. And I also did the residency program there, and I've completed 1 year of that. Loved it. Loved the people that I was grouped with. We learned a lot from each other. We did a research project at the end of our residency program, and I just built another bond with those girls. And I also built the bond with my work family, and we work really well together. From what I hear, horror stories from other new nurses about how they don't get along, or everyone's old, people judgmental, drama. But I will say, the people I work with are amazing. They're a support system away from my family support system, and so I'm loving that. I got a new car. I'm planning to move as soon as my 2-year contract is up at Tallahassee Memorial. With the residency program, they require you to sign a 2-year contract, so you know, just got to stick to that or pay those $5,000. So just doing that. Now, night shift. Working night shift is hard because if you're not a night person, you get tired. About 2-3 o'clock, that's the death hour. You're so tired. Like, I can be up right now relaxing, but it's a whole nother thing when you're taking care of patients and you got to get your charting done and all of that stuff on top of, you know, trying to stay awake. So I guess you could put it similar to, like, if you got to do homework late at night and you just don't feel like doing it, but you got to push through and do it because it's due at 8 o'clock in the morning, kind of thing. So what I've learned is that cookies, pizza, all those things with starch are so not good for you, especially working night shift, because your body is used to being up during the day and sleeping at night. And so with your body already being tired and then being up to break down those sugars and that glucose, you get extra tired. And when I mean like extra tired, I mean like deathly. And I realized that was my issue, and then also gaining weight because you're eating to stay up. And I had to learn that there is a healthier lifestyle outside of just working out. So with that, I always worked out, always loved working out, always active, but just working out either after I get off work or before I go to work, just like a 30-minute workout, nothing too rigorous, but it kind of gets your blood pumping, gets you awake and alert because you're sleeping during the day, and you wake up groggy and cranky because you know you got to go to work, you don't want to clock into work, so doing things you don't really want to do, but you know you got to pay those bills, and you know you want to travel, and you know you got a car note. Yeah. So doing that, exercising more, changing my diet, eating more salads, eating more like fruits, healthier snacks, like not Rice Krispies, but it's something like Rice Krispies, rice cakes, yogurt, things of that matter, and then trying to cut out the cookies, the pizza, you know, just trying to keep the carbs down, low carbs, and eating smaller snacks throughout the night to kind of keep you up, like peanuts or something like that. So if I have time, I'll probably like film something where I do like my nightly routine to get ready for work, so you guys can kind of see what I bring to work with me. And number one thing that I always bring to work, water. Okay, I have a 64-ounce water bottle, and I take that with me. I drink all of that. Sometimes it's hard to drink all of that and then have to pee when you got a million tasks going on. And ladies, UTIs. Make sure you're taking care of yourself. Make sure that you're scheduling, okay, I'm passing my meds here, I'm gonna go to the bathroom here, and then I'm gonna go pass my meds again and assess my patients, and then go to the bathroom again. Make sure you're doing that bathroom schedule, just to prevent that from happening, because as nurses, we put everybody before ourselves as far as when it comes to work. And you need to remember to take care of yourself. You know, if a patient is calling in pain and you have to pee first so you can take care of your patient. You don't want to be in the room taking care of the patient about their pain and then you're doing the pee dance at the same time. It's not conducive. Another thing that I want to address before I post this video for you guys is, as new nurses, you're going to be nervous. You are going to be scared that you're going to make mistakes. But honey, everybody makes mistakes. Everybody makes mistakes. They may not tell you. Okay? I'm not going to tell you my mistakes because you know, some of those mistakes get you in major trouble, but you learn from those mistakes and you move forward. And that's why I love the residency programs that Florida offers. I don't know about other states, but Florida is very adamant about whatever hospital you go to, you have to do the residency program, because they set you up with a classroom setting and they set you up with a preceptor, so you have somebody to turn to and ask, hey, is this okay? Like, does this dosing look okay? You know, just any type of questions that you can ask, there's someone there to answer them. And so that's what I really loved about it. But don't be scared to make mistakes. Always ask a lot of questions. So number one, don't be scared to make mistakes, but to prevent them, number two, always ask questions. Always ask questions, okay? And I think the most challenging thing for me as a new nurse was time management and figuring out how to complete my task on the floor. So every floor has kind of a focus. You know, ICU, they focus on their critical patients, so they do assessments based off of the critical care, all of that. Cardiac, their focus is the heart. Depending on what the floor specialty, but as orthopedics, our focus is pain management. And so I will tell you guys, if you know about medication, if you're in nursing school or already a nurse, that my biggest mistake, I'll tell you one of my mistakes. My biggest mistake was not knowing when to not give pain medication. So some people, they're okay and tired, but they're still responsive. Some people are knocked out cold, but they respond just a little bit. I don't know how to really explain that, but as a new nurse, I was so confused. I was like, we're giving oxycodone, tramadol, Tylenol, Scalaxin, all at the same time. Is that okay? Is that okay to do that? And I had to learn, you know, you have to test the limit of the patient. You have to try certain things. Ask the patient, you know, Have you had oxycodone before? Have you had tramadol before? What pain medication have you had before? Okay, you've never had oxycodone before, but this is all the doctor has prescribed to you. So let's start on the lowest dose and we'll work our way up. And you work your way up based off of the patient's pain. So if you give them the lowest dose of oxycodone and they're still in pain, you try the next highest dose when the dose is due. And so that was kind of hard. That was kind of hard for me to figure out, as far as how do I decrease pain without having a Narcan. And I will tell you guys, I've Narcan 5 times. Okay, don't judge me. Don't judge me. Okay, I just thought they sleep. I done fixed it. I done fixed their pain. No, I just knocked them out. But the most important thing is knowing that something is wrong and letting your charge nurse or your management know there's something wrong. I need help. Sternal rubbing the patient, and them assessing, saying, okay, let's give them some Narcan, let's reverse these opioids that we have given them. So that was a big learning experience for me. Scary. I was so scared. But after a while of talking to the head of pain management at my hospital, and talking to my management and asking them, how can I do better at this? That was the right way about going about things once I realized what my error was. Because sometimes as a new nurse, you don't know that you're doing wrong until something is brought to your attention. So it's always good to ask questions and to do some self-reflection and say, okay, this is what I need to work on. I need to do my research outside of work. I need to understand how these medications work as far as the time periods. And then also you have to understand that every patient is different. Some patients' pain is relieved by Tylenol. A lot of older patients that I met that are like 90, Tylenol does the fix. But a lot of patients that are 20, 25, morphine, Dilaudid. So it's just all different, and so take a deep breath for all of you that are getting ready to graduate pretty soon, fall 2018, and step into the nursing world with caution. That's what I would say. Caution. So now that I've kind of covered new nursing things or like advice that I would give, I have graduated from the new nurse experience in a way of figuring out my unit, because I've only been on my unit, so I am looking for another job to get some more experience in other things. Because as a new nurse, don't feel like just because you started on the floor you have to stay on the floor unless you really love it. And I'm looking to do ICU trauma, something along those matters. I'm looking for more critical care, because those things do excite me. Med surge, it's okay. Medical surgical is okay. It's just a different type of pace. And sometimes you do deal with people that are rude or disrespectful or super, super needy, and that kind of takes away from you giving proper care to those who need it more. As far as, you have a patient over here in pain, but this patient's like, why is nobody in my room with my food? Or why is nobody here with my medication I take every night at 9 o'clock at home? Those things. And sometimes it gets in the way of your priority, because sometimes you do have those very angry or belligerent patients that you feel like you have to address first before you can address somebody's pain. And I felt like that was difficult, but I felt like I did master that a little bit, to the point that my job has offered me to do charge nursing. So I am a charge nurse now, and as new nurses, don't feel like, oh, you got to be a nurse for forever to be a charge nurse. No, I have a friend that was a new nurse for 6 months that asked her to charge. Now she's full-time charge, making really good money, and it's just confidence, showing that you have leadership, showing that you continue to learn and that you take in what is being given to you to learn, and that you work well with others. Sometimes it doesn't benefit you to just come into work and you do your tasks and you take care of your patients and you go home. Sometimes it's good to interact with your coworkers and with management and get involved at your hospital if you're really into that. I've always been involved with different things. In nursing school, I was the vice president of the Nursing Student Association, and I did all things throughout college, like research and sports and all those things. So I brought that into my work world because I was like, I don't want to just be that person that goes to work and goes home. You know, I'm young, I'm 23, I want to meet people, I want to expand, I want to do big things, I want to travel. And so I got involved as an educator at my hospital, and I go and I educate the people that are planning for elective knee and hip replacements. I go and educate them about what to expect when they come into the hospital, what do they expect when they're on the orthopedic unit, what do they expect when they leave. And that's a big responsibility because those people, some of those people, it's their first time, and they're trying to get all this knowledge and they have all these questions. And so I absolutely love doing that. I love teaching, and I love getting feedback and learning from those who have had surgery way before I was even thinking about being a nurse. So I love that. And then I do shared governance at my hospital, and that's basically people who get together on committees and they think about things that make the hospital better. What can we do that can make the hospital better on different units? How can we get the units to work together? What's the gap of communication between the nurses and the doctors? And I really love doing that as well. And with all of that involvement, it did get me a chance to go to Albuquerque, New Mexico, which was amazing. If any of you follow me on Instagram, just scroll back to like May or April, and you'll see that I was on one of the highest mountains in Albuquerque, New Mexico, and literally you could see the clouds roll over the mountain, and it was so amazing. The oxygen was so crisp. Now, you can't do too much exercise up there because you get out of breath, okay? My phone went off and said that I was too high for the service. So I love that, and I went there so that I can learn more about orthopedics and what are the new innovative things that other hospitals are doing. And really, TMH is up to date as far as their orthopedic unit and what they're incorporating for our patients as far as pain management, preventing opioid addiction, innovative things for our plastics or emergency plastic surgery patients or our orthopedic patients, and how we take care of preventing them from getting infection. So that was pretty cool. Guys, like, I love nursing, and I wouldn't really change it for the world that I chose it. Now, do I see myself doing floor nursing forever? No. I plan on starting school pretty soon to get my ARNP, and I really want to focus into the trauma part. I prayed and I prayed on what path did God want me to go on as far as my next step in life, and I think I found my passion as far as what I want to do. I'm not closing the door to cardiac, endocrine, any of that, you know, whatever is presented in front of me. But right now, my heart is really set on traumas. I love traumas. Not that I don't wish bad on people, you know, but people get hurt. And it's so cool. It's just so cool to watch them heal after 3 months of being in the hospital, and watching them go home, or going to rehab and they're like 10 times better than they came in. Okay, I'm telling you, these people come in unconscious, almost knocking on death's door, and we restore them to full health or almost full health, you know, with minimal complications. So really love it. So if you guys have any questions, want to see more videos about nursing or more advice that I can give, please in the comment box let me know.